Have you ever felt hopeless in your life? Have you ever had the feeling there is absolutely no way out of a situation? We medical doctors were taught to be rational and to use evidence-based medicine. But medicine is much more. Years ago, I had a patient at the clinic who had a chronic infectious disease. At that time, the treatment was just to treat the complications of the disease, so not a real treatment. There was only one real treatment, but it had just a 30% healing rate. 30% healing rate, it means that 7 out of 10 patients do not react on the treatment. I remember this patient who had a severe, big dilemma, whether to undergo this treatment or not, because this treatment was a long treatment. It lasted 6 months, 1 year long, and had big side effects. This patient wanted to get rid of the disease. He had a big hope that he will be cured if he undergo this treatment. So at the end, he decided to do it. We were fighting together against the side effects, against the whole situation, but at the end, he got healed. He completely recovered, and he now has a full life. So he wanted to get rid of the disease, he focused his hope, and he won. Another patient had a severe cancer of the blood cells, a type of leukemia. At that time, the treatment was again not a total treatment, so the patient's condition were declining again step by step. We were before the last chance, a bone marrow transplant. A bone marrow transplant, it means that the damaged bone marrow from the patient is taken and a healthy bone marrow stem cells for another person is transplanted to it. It's a very, very serious and hard procedure for the patient. We were fighting for the life of the patient. The patient was under this very serious intervention. But we knew that there are big research in the pharmaceutical companies to find a new medication. So we kept hope alive in the patient. And suddenly, the new medication came out to the market. So it was accepted for use. We gave it to the patient, 2 pills a day, and within 2 weeks, the condition of the patient dramatically changed, and he's almost totally recovered. He is now under 2 pills and has a full life. So we hoped that the new invention will come and kept hope alive in the patient. So now you are beginning to see that hope has a dramatic, important role in medicine, in healing process. Not long after I have finished medical school, an old lady was taken to the hospital. It was duty time, late night, when the ambulance car arrived and took an old lady with a serious stroke. So the lady couldn't move her right part, arm and leg, and could barely talk. We made the necessary diagnostics and the treatment, what was the best at that time. And there was another colleague, of course, who was in charge, an older, more experienced one, and told me, Adam, in these cases, we give only supportive treatment. And there is really little hope that this lady will ever move her right part. And it is also possible that she will not overlive the night. And this lady reminded me very much of my grandmother, whom I loved very much. So this case touched me extremely. Next morning, we stepped into the ward to see the patient, to visit her, and to decide the next diagnostics and treatments, when the bed was empty. An empty bed could mean the worst in a hospital. So we rushed out with my colleague, searching for the nurse, and to know what happened during the night time when we saw the old lady. We saw the old lady walking towards us and smiling. And she told us, "Oh, dear doctors, I'm so happy, and I'm so thankful and grateful for you for your help last night, and I've just come out for a short walk." It was an amazing, unexpected and unexplainable event. And we were very happy that we could help her. So there is always hope. So through my experiences, I had to accept that hope plays an important role in medicine. The doctors had to do their part, but so do the patients. It is a good feeling, it is a gift to see patients to be in the lucky 30% and to see that they recover. The world is rapidly changing. Even 1 or 2 weeks can make a huge difference, a dramatic difference. So there could be always new inventions which could change situations and which can solve problems. But nothing ever can replace hope. There is always unexpected or unexplainable event which can totally change situations. I have seen it and I experienced it time to time again. And what is a great thing about hope, that it is true not only for medicine, but for life as well.